Hello everyone, welcome to another video. Now INICET is just round the corner. The exam is on 18th May. So we have around 2 months left for INICET, and in this video we'll talk about the 2 month strategy for this INICET May 2025. Now I'm very excited to introduce Dr. Aman. I'm sure you have seen Aman in my previous videos also in our channel. So Aman is my junior from AIMS Delhi. He's currently doing his MD in nuclear medicine from AIMS Delhi. So, welcome, Aman.
Thank
So
you.
nice to have you.
Thank you so much, Dr. Rishabh, to invite me. Before we start this video, a small disclaimer for all of you. So, this video is addressed for you if you have not started anything for NEET PG or INICET or anything related to PG. So, we will talk from the very scratch how you have to build your PG preparation and then achieve your dream medical college and a dream branch.
Yeah, so if you are someone who has been studying for, let's say, 1 year, 1.5 years, or 6 months, in fact, this video is not for you. Okay, so maybe you can skip this video, save your time, invest your time in something better. We are not here to waste your time. This is specifically someone for someone who is lost and starting now.
Yes.
Right. Now, the first question will be, should you prepare for this INICET or should you wait for next year's INICET? Now, the simple answer to this is you should prepare for this INICET. And in fact, I'll give you my example, my story as well. So in my internship, I did not study so much. I was in the mood ki next year I'll give. But my senior told me this, that Rishabh, if you study now, whatever rank you get, this will only help you in the next preparation. If you don't study at all now, the next cycle will go 1 year later.
Basically, your baseline gets decided. Whatever rank you get here, you have a chance to improve it with your preparation. And there's you would have heard this about Pygmalion bias, in which increased motivation and increased expectations will lead to better results.
Yes.
So when you said, let's say you get X rank in this INICET, now that will be a benchmark. Every day you will waste in between that INICET and the next exam which you are giving, you will feel bad, and that will keep motivating you to work hard enough and achieve a better rank in the next exam.
Yeah, so if you don't study at all and give this INICET, maybe you'll get a rank of 50,000. But if you study at least for 2 months and you get a rank of 5,000, your baseline is to jump from 5,000 to now top 500.
Yes.
Whereas otherwise it would be to jump from 50,000 to, let's say, 5,000. That's a very, very big difference. And that's a very different mindset that you will appear. So let's not waste any further time. Over to you, Aman.
Yeah. So basically, INICET, the rule is very simple. Point number one, INICET focuses on first and second year. Point number two, INICET focuses on previous year questions and topics. And third thing, which is valid for every exam, repeated revision and self-study is the key to success. So we'll address the first thing, which is the important subjects in INICET.
So if we look at the overall 19 subjects, INICET has around 60% weightage from these 8 subjects, and these 8 subjects constitute around 120 questions. Now, what are these 8 subjects? Anat, Biochem, Pharma, Path, Micro, Surgery, Obs-Gynae, and Forensic. Right? If you master or not master, at least you are prepared for these 8 subjects. At the back of your mind, you are set for 120 questions. Right? Agar 120 out of these 120 questions, if you have read, you will at least be able to answer 100 questions. And that is a very, very good baseline to start with. So these are the 8 subjects that you should focus on in these next 2 months if you're starting from scratch. Now for the rest 40% of the subjects. So we have minors, some majors like medicine, pediatrics, physiology, and remaining subjects, right? I think that you should focus less on those, especially because you have only 2 months left now and you're starting from scratch. Now, these are the subjects to be read. That is point number 1. Now, in these subjects, what to read? That is our point number 2.
So we'll come to the content. So for the 8 subjects which we have told, you can either go for rapid revision notes, which are good in any of the app like Marrow and PrepLadder. These two apps which I have used, and they are very structured revision notes which are made. So revision notes, try with the revision notes. If you think that you need revision videos, supplement notes with videos, but always remember that you cannot revise the videos, but you can revise the
Right.
notes.
Yeah.
So highlight those notes so that in the next reading you can revise these highlights, and supplement this with PYQs of past 10 years in which INICET and NEET PG are included. Over to you.
So as Aman rightly said, RR notes plus RR videos plus PYQs last 10 years, sort of sorts you in these 8 subjects. Now, he mentioned about Prep Marrow. I'll also mention about MEDED because that is somewhere where I teach. So in MEDED also, RR notes plus RR videos are given to you along with important question banks. So around 2,500 questions from these PYTs are included there. You can also check that out. So for these 8 subjects, either this is your strategy, you for these 8 subjects, you अच्छे से very well you read these RR notes, watch RR videos, add extra points to your RR notes, do last 10 years PYQs, add extra thing to your RR notes. Basically, what do we want? That these RR notes become our sole source of revision. That is the whole point. Now, when you are solving your PYQs of these 8 subjects, explanations take a lot of time. Now, since you're already reading RR notes, RR videos, only watch explanations of those questions which you get wrong and add the explanations again to your RR notes. That is the whole plan. Now, what to do for the remaining 11 subjects? Now, Aman.
Yeah. So I think for the remaining subjects, honestly, it is not possible to read through the entire revision notes also in the remaining time. What you can do is do the PYQs of past 10 years, NEET PG and INICT. But for them, it is very important that you see the explanations. If
Yeah.
possible, if you get time, also read the related topics, but it is less likely that you will get time. So
Time.
just the PYQs of last 10 years plus explanations.
This is what, in fact, I did. So when I appeared from a May exam, and in fact, most of the toppers also do this, it is impossible to, complete 19 subjects cover to cover. Nobody does it, not even toppers. So cheat code for you is that for the remaining subjects, just go with PYQs. I did only PYQs of ENT, anesthesia, psychiatry.
Yeah, which you have repeatedly told in your videos.
Yeah.
And even I had heard this from you when I was watching your videos during my PG preparation.
Yeah. So what this will do is give you sort of it'll give you a feeling of completion that you have at least touched every
It
subject.
will give you the most important thing which cracking any examination requires, that is confidence.
Yeah.
That you are through with the entire
you have,
syllabus.
You have touched every bit. That is very, very important. Now, the second question that I want to ask you, Aman, and this is like the elephant in the room, is BTR enough?
So this is something which we'll be commenting upon this video. So we wanted to address this. So in my opinion, if I was a student, I believe if I was starting from zero, exactly 0 point, I don't think that 4-day offline BTR course would have been enough. However, if I had to stick with BTR, I would have stuck with the entire BTR schedule and supplemented it with 10 years PYQs, and that should be the thing. So
Yeah.
either I would recommend you that you can follow this RR notes plus RR videos plus PYQs plus minus explanations for the 8 important subjects, plus for the remaining subjects PYQs of 10 years plus explanations, or you can follow the complete BTR schedule and supplement it with PYQs.
Yeah, I would also like to add that for these remaining 8 subjects, for the remaining 11 subjects, you are only doing PYQs. So if you have sort of like a rapid revision program book, like BTR booklet you have, annotated BTR booklet you have, along with these 10 years PYQs for some theory, you can also refer to that. Because, their minor subjects are given around 10-15 pages only. So that's not a bad idea, right? Now let's come to final timelines. That how much time do you have and how much time you can devote. So if we consider today, now today might be any other day depending on when you watch this video. We know the exam is on 18th May. So we have around 60 days plus minus 10 days. So I have kept the last 15 days separately for a revision. Since you are starting now, you don't have a luxury of 2 or 3 revisions. Only one revision you will be able to do, right? So in the next 45 days, your target should be to complete first reading. What do I mean by first reading? The 8 subjects, you should be able to complete the RR notes, RR videos plus PYQs, plus the remaining 11 subjects. You are completing 10 years PYQs.
And where can you get these PYQs? You can get it anywhere, but my senior, Dr. Aditya, Dr. Rishabh's batchmate, he has made this beautiful app by the name of Reflex, which you can use. Or if you are solving via a Marrow or Prep Ladder, they are also equally good.
Yeah. So in these 45 days, your target should be at least these 8 subjects you should complete, and 8 subjects, 45 days, around 5 days per subject you have. We've kept 5 days again buffer. So subjects like forensic can be covered in 2 days. So you can, adjust your schedule in a way that you give appropriate time to your weak subjects, right? And in the last 15 days, what you should do, Aman?
Yeah, so in the last 10 to 15 days, you have to go through the highlights of your RR notes. Plus, you would have made a choti copy by then. And what do you have to have it in this choti copy? The staging of cancers, the triads, classification of
systems.
the liver injury scoring,
Hmm.
or anything which you think that you will forget, like
BNS
milestones, PD.
sections, milestones, very well said.
Yeah.
IPC sections, BNS now.
Yeah. So that is what you need to revise just last 1 week or even the night before the exam. Only then you will be able to recollect it. Plus, what we have said is that for the 8 subjects, you devote 1 day each, and for the rest subjects, give half day, or even if you can do 2 to 3 subjects
per
even
day.
in a
So
day.
last 15 days, the idea is, जो 8 major subjects we have told, 1 day for each revision, and minors and other 11 subjects, half day. Now, a big question comes, what about medicine? What about medicine? Now, my personal opinion is that it's not wise to invest time in medicine.
Even if you think that
Yeah.
you should invest and you are not able to let it go, just do the ECG, just do the
Electrolytes,
emergencies. That's all.
Yeah.
And you cannot go through the entire medicine. So it is this way: either you follow the schedule or you just do medicine for the next 2 months.
And it's not so worth it. A lot of questions of medicines you'll be able to solve by path, pharma, pediatrics, your general internship, etc. And again, medicine is something you have read in final prof. So it's relatively fresh as compared to, let's say, first and second year subjects. So you should invest more time in them. Right? Now, if you follow this strategy, and if you follow this strategy rigorously, like studying 10 hours per day, solving PYQs along with annotating them in your RR notes, believe me, you have a very good chance to get a top 1000 rank.
And trust me, if you get a top 1000 rank, or even if you get a behind rank, like say 1000 to 5000, you still have a chance. You have 1.5 months based on when NEET PG is conducted. You can like study as much as you have never before, and you have to just continue this rhythm, and you are gonna get a 2 to 5K rank in NEET PG, and you are going to get your dream.
Yeah, because it is such a good motivation, when you get a good rank, and no, I'm not talking about top 100 rank. So for a student who is starting now, for him a top 1000 rank is also a very good booster. And as he mentioned, Pygmalion effect, a good outcome motivates you to do even better. Okay, so with that motivation, if you go for NEET PG, I'm sure you'll get a very good rank in NEET PG. And trust me when I say this, give this INICET a very, very serious attempt. Don't just think, okay, INICET, I don't deserve, it is a central institute, I am from a private medical college or a peripheral state medical college, which I can't go into central institute.
So that thought block has to be removed.
Yeah, that thought block has to be removed.
There are people even in top 10 who are from private medical college, leave the peripheral medical college.
Yeah.
So that thought block has to be removed, and you just have to give your 100% for INICET. It's like you are reading for NEET PG as well, doing that.
Yeah.
But this is giving you kind of a mock test, giving you a
real
timeline,
GT, a real GT.
and real GT.
Yes.
That.
So that's all from our side. All the very best. Do comment your queries in the comment sections. If you don't want to comment here, you can DM me or Aman on Instagram. I will be happy to answer your
Or
queries.
any other topics you would like us to make videos on, please do comment them as well. Thank you so much for hearing us out. If you like this video, please do subscribe to Dr. Rishabh's channel and hit the like button. Thank you very much for watching this.